kind of study. For example, which province has more women going for antenatal care, which particular community has lesser. So the dynamic is that you can be able to analyze different variables with a particular dependent variable. So if your dependent variable in that regard could be maternal mortality, you want to understand which society is having more maternal mortality than the other. And what happens is that you should be able to understand what are some of the factors. For example, you would want to look at issues of culture, say tribe. In the African context, we call it tribe. Say because the DHS collects information according to tribe, local languages, and so forth, you're able to understand which tribe has more maternal mortality, which province has more maternal mortality, which age group has more maternal mortality. Is it urban or rural? What is the place of residence where there is maternal mortality? But you also want to look at whether the level of education has an effect on maternal mortality. Are people who are going to primary school or people who have at least a primary level of education more likely to have more maternal death than those who have tertiary? So those are some of the analysis that occur if you have access to what we call the demographic health survey program. So the questionnaires are standardized and they are adapted to that specific context. But the questionnaires also cover topics such as what we call the household characteristics, the fertility, family planning, maternal and health, and maternal and child health, nutrition, HIV/AIDS, malaria, and gender issues. So the questionnaires are translated into local languages and they are often pre-tested before field work, just as for any research where you always have to do a pre-test. And I'm very sure we do understand how we develop questionnaires in research. If not, we shall have a deliberate session that is not very long, so that we do understand some of the concepts when we are designing questionnaires. But I'm very sure those who have interacted in this particular in with me in these lectures have been able to have a concept of how to develop questionnaires. And similarly, the same way you have an approach in designing questionnaires for reproductive health research, it is the same way you should be able to have an idea of how to develop questionnaires regarding concepts of fertility, concepts of family planning, but also concepts of household characteristics. Another concept in survey design is what we call the biomarkers. Biomarkers, these are biological aspects in research that have got to be measured using what we call biological means. The demographic health survey collects biological data from respondents to measure their health status and exposure to disease. So biomarkers are actually indicators or measures that are used to understand population health status, but also how they are exposed to disease, the level of exposure, how susceptible the population is to disease. And the biomarkers in the demographic health survey, some of them include what we call the height, weight, blood pressure, hemoglobin, anemia, HIV, malaria, syphilis, hepatitis B, and urine tests for iodine and salt intake. So the biomarkers are collected by trained staff using standardized procedures and equipment. So the advantage of the demographic health survey is that this is actually where the demographic health surveys are very important in trying to understand the population. because they go further, unlike population censuses, they go further to understand scientifically and biologically. So what happens is that the demographic health survey program will employ health workers. So that is, for example, uh, some of you here are working in health facilities, probably as a clinician or as a midwife and so forth. So you remember that every client that comes, there's always a standard test that you offer them. For example, if a mother came for antenatal, there are certain tests that you must conduct when the mother comes for their first antenatal care visit. You must conduct their height, their weight, their blood pressure, but also you must do a HIV test. And most times it is also very important to do the malaria test, hepatitis, and syphilis tests. So these are actually biomarkers that you can use to understand the risk or the risk that or the susceptibility of that particular client. So the application of this is that in your ward, as an in charge possibly, or as an officer that is working in a health facility, the application should be that you're able to collect data on all your mothers. For example, if you had 20 mothers in a month or in a year, if you had 20 mothers visiting your health facility and you conducted all these biomarker tests, their height, their weight, their blood pressure, you should be able to analyze individual data. How many positive cases of HIV did you have? How many cases of syphilis? How many hepatitis B? And you subject this to their demographic characteristics. What is the demographic characteristic of individuals who are having high blood pressure? Could it be they are coming from families that are educated? Could it be they are coming from families that are living in the urban area? So then it is about, after doing such an analysis of the clients that come, it is now upon you as a demographer to be able to identify what possible solutions you can offer, but also you can be able to communicate the risks to particular individuals because you have been able to analyze the data that they have provided for you. So the concept again in DHS design is what we call data quality, and it is one of the core principles of research, what we call data quality, and therefore it as well applies to the demographic health survey designs here. And we're saying that the demographic and health surveys or the DHS surveys ensure data quality through rigorous training of field staff, supervision and monitoring of field work, data entry and editing, and data quality checks. So the data quality is assessed by various indicators such as response rates, completeness of data, consistency of data, and sampling errors. And in this particular module, we shall be able to look at some of the sampling errors, but we shall also be able to look at the consistency of data. Later on, we shall be able to look at what we call outliers. And the demographic health survey is very consistent in trying to identify those outliers as a means of maintaining the data of the data quality. So what happens is that if you have been reporting antenatal eighth antenatal visits in your facility, if you have been reporting 10 mothers in January, say we're looking at annual number of mothers who have at least 4 visits for antenatal care. If you have been reporting 10, 20, 30, 40, 20, 30, 25, 50 for about 6 months, Then on your 7th month, you report about 100 mothers who come for the antenatal visit. That shows that there is an outlier, and it could be an indicator that probably you have data quality issues. So those are some of the techniques that the demographic health survey uses in trying to understand their data quality. And therefore, data entry, editing, and data quality checks are done. And this includes even doing validation at a grassroots level, where individuals who have been asked are validated by bringing back their responses and continuously asking them whether truly data that has been provided is a true representative or representation of what they said. And the other design is what we call the online tools. So, like I had stated earlier, it is very important that each one of you interact with the DHS program as a website. It is very important that each one of you interacts with it, because majority of what I am explaining here is actually just what is practically on the website. So they have what we call the online tools. The design is in that the DHS provides various online tools for users to access and analyze the survey data. And these include what they call the Stat Complier, which allows users to create tables, charts with indicators from multiple surveys. And there's also what we call the DHS API, and which allows users to access the survey data programmatically. But also it has a mobile app. The DHS program has the mobile app, which allows users to access survey indicators on their mobile devices. So on your phone, you can actually be able to download that DHS program, and you're able to do analysis of data. And this is where consultancy comes in. Your skills in doing data analysis can be improved when you access these particular modules. But then lastly, they have what they call the DHS model datasets, which allow users to practice data analysis skills with anonymized datasets. So it is important that you pick interest in trying to do analysis, but also in trying to understand the DHS survey online tools. And that brings us to a very important aspect of the DHS, which is what we call the data sets. So there are very many individuals or researchers do not actually have the financial muscle to do data collection and surveys for the entire country. Therefore, the DHS program offers researchers, demographers, students, and so forth a very great environment in accessing data sets where they can do analysis, where they can do studies, and so forth. Secondary studies, they can develop research topics and so forth from the DHS datasets. So the DHS provides the survey datasets in various formats for users to download and use for their own analysis. And the formats that the DHS provides is the SPSS, what we call statistical packages for social scientists, the Stata, we have SAS, we have ARA and CSV, and other flat files. So the datasets are available at different levels of aggregation and anonymization, such as households, individual, couple, children under 5. We have biomarkers, GPS, etc. The datasets are accompanied by documentation such as code books, record manuals, and questionnaires. So if you have statistical packages, analysis like Stata, SPSS, R, and so forth, you can actually be able to download these survey datasets and you do broad analysis. You may not even need to go to, most times when people are given research studies to conduct, they actually look for primary data. Sometimes you may go to your small village there and sample about 30 or 100 or 150 people in your entire sub county or in your area there, and you try to try to do a research about them as your dissertation. Most times the question is how relevant is academic research to solving problems in the society, because as scholars, as students or as scholars of demography, you should be able to impact the society in a broader aspect. So, whereas you may do an academic research of 100 people collecting primary data, it may not be significant in trying to solve problems in the society. However, the advantage the DHS offers you is that it provides you a data set for an entire province or an entire region. So you're able to do analysis that can impact policy, that can impact decision making. Because then, if you run analysis for region, probably showing how there is communication inequality, or that there is family planning inequality, or that there is gender-based violence, probably more in a certain village or in a certain region, then policy makers and agencies can use this information to try and solve problems that you've stated in your research. So, we want to look at the reports, the DHS reports. So the DHS reports provides comprehensive reports for each survey that presents the main findings and analysis of the survey data. Just as research, where we talk about dissemination of findings, the DHS as well does the same and provides reports to the different stakeholders. If you logged into the DHS program, you can be able to access DHS reports for all the countries as you wish. And the reports cover all the topics such as the demographic and socioeconomic characteristics, fertility and family planning, maternal and child health, nutrition, HIV/AIDS, gender issues, among others. And the reports also include tables and figures with key indicators and trends. The reports are available in English and sometimes in the local languages as well. So you can be able to explain the reports as be able to read the reports and be able to understand the findings of the DHS. The DHS indicators are standardized measures that are derived from the survey data to describe various aspects of population health. These are indicators that are defined according to the international standards by the WHO, by UNICEF and UNAIDS. The indicators are categorized into different domains. So fertility has its indicators that are standardized. For example, under fertility, we can look at total fertility rate. We can look at aspects of reproductive progression rate and so forth. We can look in family planning. Family planning has its indicators such as contraceptive uptake. Maternal health also has its indicators such as maternal mortality rate, maternal mortality ratio. Child health has its own indicators such as immunization. Nutrition as well has its own indicators on stunting, on malnutrition, on weathering away. Then HIV has its indicators as well as malaria. So the DHS has standard indicators that you can try and understand. So you will even realize there are modern family planning methods, there are traditional family planning methods. So you will want to do a comparison between the use of modern contraception vis-a-vis traditional contraceptive measures. The interpretations are the DHS indicators are interpreted by comparing them across time, space, subgroups, or benchmarks. Just as I have been explaining regarding analysis, you can be able to interpret the indicators over time. For example, since the survey is done after every 5 years, you should be able to explain trends ranging for the last probably for the last 20 surveys that have been done, for the last 3 surveys that have been done, but also through subgroups. For example, subgroups according to a place of residence, subgroups according to educational level, subgroups according to marital status, subgroups according to age. The interpretation provides insights into the pattern, trends, disparities, or the achievements of population and health outcomes. The interpretations are guided by contextual knowledge, analytical frameworks, or policy implications. And that is what we call the DHS survey design. And that is what I wanted us to look at today. But as I conclude, I designed what we call the survey design case study of Uganda's demographic and health survey. So what I have been explaining regarding survey design is actually we have a case study here, and I just want us to run through the case study. I think we are almost approaching 1 hour, but I want us to run through the case study as quick as possible so that we can conclude and handle another issue tomorrow. We shall introduce ourselves to population data. So for Uganda's case study, the sampling frame used for the Uganda Demographic Health Survey is the frame of the Uganda National Population and Housing Census that was conducted in 2014. So you recall in my earlier statement that when you're doing household listing, data is used from the previous survey or census that was conducted. So in this case study, you're able to see here that Uganda was able to use the frame of the population census that was conducted in 2014 to sample the households for their 2016 UDHS. So the sampling frame was provided to them by the Uganda Bureau of Statistics. And yesterday, when we were discussing who conducts the UDHS, we were able to state that the statistics offices of the particular countries are responsible for providing technicalities in conducting the DHS. The census frame is a complete list of all census enumeration areas created for the 2014 National Population and Housing Census. So in Uganda, an enumeration area is a geographic area that covers an average of 130 households. So now this is what we call a sample design. So if you're designing your research area according to households, from this example, you can be able to see that an enumeration area was a place where there were 130 households. So where there were 130 households, this was considered an enumeration area. And one where it was not more than 130 or it was less, it was not considered. And this is what we call sampling. So the sampling frame contains information about enumeration area location, type of residence, and the estimated number of residential households. So just a brief here was that Uganda was divided administratively into 112 districts. And these districts were further grouped into 15 regions. So the sample for the UDHS 2016 was designed to provide estimates for key indicators countrywide and for each of the 14 regions there in that statement. So the sample was stratified and selected in 2 stages. Remember, in our introduction, we were able to explain that the DHS is a 2-stage stratified sampling technique. In the first stage, 697 enumeration areas were selected in the National Population Health Census. Then 162 in urban areas, 535 in rural areas. So the clusters are written as in there. We're just giving a brief as a case study. However, when the notes are shared, you'll be able to go further and understand what happened. So a listing of households was compiled in each of the 696 accessible selected enumeration areas, and maps were drawn for each of the sampled clusters and all of the listed households. This is what we call sampling. Now, these are all processes through which sampling was done. So to minimize the task of household listing, each large enumeration area, any enumeration area that had more than 300 households, was segmented. Only one segment was selected for the survey. So a huge household, a huge enumeration area was segmented, meaning it was divided into portions, and only one of the portions was selected for the survey. So that is just a description of how you can further sample or how you're able to generate your sample in terms of sampling in research. So you can choose women, women of reproductive age. But among women of reproductive age, you further go ahead and look at women who are pregnant. You further go among pregnant women and look at women who have attended 4 and above antenatal visits. You further go ahead, if the sample is still big, to divide the women who have attended 4 antenatal visits to women who live in a particular village. So this is how survey sampling is done, and that is just the brief in sampling, in survey sampling that I want us to look at in there. So as we discussed in a survey design, we also discussed an aspect of questionnaires. So in a case study for Uganda, 4 questionnaires were used in the 2016 UDHS. One is what we call the household questionnaire, then the woman's questionnaire, the man's questionnaire, and the biomarker questionnaire were used. The questionnaires based on the DHS program's model questionnaires were adopted to reflect the population health issues that are relevant in Uganda. In addition, information on the survey field workers was collected through self-administered field worker questionnaires. So here we are again further showing how questionnaires were developed, and we're saying that input was solicited from various stakeholders representing government ministries, agencies, non-government organizations, development partners. After the preparation of the questionnaires in English, the questionnaires were then translated into 8 major languages in Uganda. And you can see the languages there: Nakaramejong, Luganda, Lubara, Luo, Runyankole, all these languages that are common. So even in your research study, this is what you should be able to apply. After you've developed your questionnaire, you should be able to seek opinion from key stakeholders that you intend as part. of your study, so that they are able to offer you guidance in your questionnaire, in developing, but also in updating your questionnaire. But you should also be able to have a local version of your questionnaire, probably in the local language, so that people are able to understand what you intend to ask them. So further, we're giving a description of how the questionnaire for the household was developed. So the household questionnaire listed all members of the and the visitors to the selected household. Basic demographic information was collected on the characteristics of each person, including his or her age, sex, marital status, education, and relationship to the head of the household. And that is how the household questionnaire was developed in there. And then, if we were to look at the man's questionnaire, it was also administered to all men aged 15 to 54. So, in the sample, in the sub-sample of households selected for the male survey, the man's questionnaire collected much of the information elicited with the women's questionnaire, but was shorter because it did not contain a detailed reproductive history or questions on maternal and child health. So questions on maternal and child health were only asked to the mother in the woman's questionnaire. And then the biomarker, as we said, is a biological aspect, and therefore it recorded anthropometric measurements, anemia and malaria testing results, and blood sample collections for vitamin A testing in the laboratory, as well as signature of the field worker or the health technician. So that is just the brief of a case study of how of how the DHS was designed in Uganda. So you can be able to see that the interviewers used tablets to record all questionnaires and the responses during the interview. So the tablets were equipped with Bluetooth technology to enable remote electronic transfer of files. But also the CAPI data collection system employed in 2016 was developed, and you can be able to see that the survey protocol, including biomarker collection, was reviewed and approved by the ICF Institutional Review Board. And this last statement brings us to the other aspect we discussed regarding ethics of the DHS. So these are research protocols that must always be followed if you're conducting any other study or if you're seeking opinion from individuals. So that is what I prepared for us to understand today, and hope tomorrow at the same time we shall be interacting with what we call population data. And therefore, I request that today we work on the aspect of the aspect of going through the DHS program. Probably you need to find some little time tomorrow to be able to go through that particular aspect, because there are certain sessions where we will need to go practical if we are to understand this aspect of demographic surveys. So to that far, unless we have any other questions for today, I would want to end there and hope that tomorrow we probably keep the same time so that we are able to complete this probably as the week proceeds. Thank you very much.
Thank you too.
So Samuel, back to you. If there are no more questions, I wish to end there. Do we have any questions, or we do not have? Or do we have any other?
The request.
Yes, please.
Yeah, this note, if it can be shared for us in our platform for reproductive health, the notes. This one here.
All right, I will be able to share with the director the notes tomorrow, Probably I will ask him to share them with you in the group.
Yeah, it's all right.
All
Okay.
right. Have a good night.
Same to you.